Going on, everybody? Welcome to the Deplorable Voice. My name is Jay. I have my guy Toby here.
Hey,
What's going on, Toby? How you doing?
good. How you doing?
Good. And we have Mark with us again. We had him on a phone interview, I think a week and a half ago.
Yeah.
Now we have him right here, so everybody can see him in the flesh.
Woo-hoo.
I don't know if that's a good thing, but thank you.
All right. So we're going to be covering the national emergency declared by Trump just probably, 30 minutes to an hour ago. We're going to kind of go through the rundown of the address itself. I want to start off first with the virus has been confirmed in people in 46 different states so far. They started off the address by saying any U.S. citizen coming from Europe required to undergo 14-plus day quarantine. Every person other than U.S. citizens are restricted from coming to the United States from Europe other than the U.K. First thing Trump kind of started off with was saying that emergency operation centers are in every state now. He is going to waive the telehealth program or restriction, which allows doctors from other states can go anywhere. So if there are certain states where that become a hot spot, these doctors can travel to go to these other states, even though they are only licensed in a certain state. He is going to enlarge the emergency room capacity. So that means if you are in one of these hot spots, don't be surprised if the first thing you walk into the hospital, I'm not trying to freak anybody out, but don't be surprised you walk into the hospital and there's hospital beds everywhere. All right. These are just so that we can have enough beds for everybody so that, if you can get treated right there in the hospital rooms, you can, get a ventilator and all that if you need it, get your vitals, everything right there in the hospital waiting room. So these are different restrictions and regulations that are being lifted so that we can allow for maximum capacity in our hospitals. Next thing I want to go over is the FDA approved new test that has come out. All right. 500,000 tests should be available next week. Don't know the accuracy of that. I assume that is probably just a goal. By next week, there should be 500,000 of these tests. We'll get into the whole media part about the reports on these tests. But from what the doctors had said in this press conference is that the South Korea test, which the media has been talking about, why didn't we get these testing kits or whatever? There's a positivity rate between 3 and 4% on these tests. The test that they just came out with has a positivity rate between 1 and 2%, which is that cuts it in half. Basically, our test is 2 times more effective than the tests that they had going on there. We'll talk about more kind of why probably the administration didn't jump on that right away and start, mass ordering these tests. All right. Anyway, quality matters on that. That's just kind of my opinion, but we'll touch more on that. Trump had Dr. Tony Fauci come on, and basically he said, removing the constraints of the regulations and containment, mitigation, and suppressing the curve. If you were to put this on a graph, suppressing, the curve of infections and deaths is the number one goal. Public-private partnership, okay? If we couldn't stress capitalism anymore, this is so important. We have Walmart, Walgreens, Target, and CVS providing portions of their parking lots for testing sites that will be set up so that you could drive through in your car, get tested in your car, and then if you really need to have a test done, all right? And these hospitals are at maximum capacity in these hot spots. These are not going to be at every Target, CVS, Walgreens. These are going to be where they are determined that they need these resources. Anyway, Increased supplies. Also, they talked that, you know, the certain supplies that they saw that they were running through, they are going to order in surplus. So there will be way more than what these orders, with these stores, a lot of these orders are made 2 to 3 weeks in advance. They are going to basically double, triple whatever they need the order to be. Mike Pence came on and said they're increasing the inspections at nursing homes. And there will be no visitors at nursing homes unless it is a situation where that person is, you know, close to death, or there's a situation where, you know, they, like I said, they're going to be transferred to another place or whatever. There will be no visitors, just to, you know, a precaution. Anyway, Medicare, Medicaid, suspending regulations on Medicaid and Medicare. Like I said, yeah, nursing homes temporarily restricted. I'm just looking at my notes real quick. Yeah, that's all I got down for my notes there. But there was a lot of regulations and restrictions. I'm not a genius. I'm not an expert in these things. I don't know why we have all these regulations. I assume that they might be for something. Sometimes you'd be surprised that they're, you know, why we have regulations. Sometimes it could be for, you know, absolutely nothing. But we're going to get to Toby here, who had some notes there. Toby, if you want to cover anything I didn't put down there about the address.
Of course, thank you. I appreciate that, Jay. I really appreciate it. So, I was doing more case notations and whatnot after he did his announcements and whatnot. He did have the press questions released. One of the press questions released was how many tests a day can local facilities have equipped and be taken care of. And there's approximately between 15,000 to 20,000 a day. So 15 to 20,000 people a day can get tested if you qualify under these circumstances. If it's a situation where you have the same symptoms, you're not going to get tested unless you're in like what Jay said, unless you're in a hotspot. If you're in a hotspot, then yes. But if you're in a rural area where there's like no evidence of even close to having that, it's more likely it's just in your head. In reality, because if you're not nowhere at all near a hotspot zone at all, period, and you're really concerned about that, your mind can actually produce a lot of the same symptoms in reality, which is not even not having that case. One thing he did talk about is that travel restrictions. So people going from people from the stateside coming back home would be under a 14-day quarantine. Unfortunately, there won't be allowed no European site personnel to come to the stateside during this situation. You know, people that are like come over for vacation over there, ain't gonna happen. He was able to clarify that during the communication with the press.
And the question and answering it.
So that's which I prefer. I actually like that idea because it means we can't continue to get more people coming in.
Right. I don't see how it could be a bad idea.
No.
Do you have anything else? Do you have anything else there before we get to Mark here and kind of run through his brain on this?
There's a few more things, but I can always cover that after a while.
Well, okay, Mark, thank you very much for being with us today. Mark Nadeau. Did I say it right?
Uncle Mark.
Uncle Mark. Uncle Mark is a pastor in Presque Isle, Maine, and we really appreciate him coming on. And he has stayed extremely informed on really our political environment, current events, world environment right now. So thank you, Mark, for being with us today again.
Yes, thanks for having me on. I'm enjoying it. You guys are doing a great job.
Thank you. I just want to ask, first and foremost, what did you think of the address, and kind of what do you think is going to become of this address, kind of the reactionary phase of this?
I think it was unfortunate that he had to go to this stage this early in the event, but he was pushed into it. He had no choice. He was losing the momentum of the public information war, and I think he had no choice but to jump ahead of it again, and he's done a great job. I mean, as a president, I think we could be proud of him compared to other presidents facing far worse issues like the swine flu, bird flu, other types of pandemics that have tried to break out over the years. I think it's unfortunate that he had to make a national declaration like this, because let's look at what's happening right now. People are panicking just because of certain cities making certain announcements. California did it deliberately. New York did it because they are part of a bigger process, part of a bigger program, and they're all working together, and I mean this, to crash the economy of the United States. Even beyond Trump, the globalist program that has been put in place since the 50s and 60s in this country is an attempt to bring us into line with global vision, with global ideas, the new world order.
So just to kind of, if I was to play devil's advocate and I say, hey, Mark, that sounds like a big conspiracy theory.
Sure.
That's all a conspiracy theory, right? Say I'm not a Trump supporter, but I'm not I'm not in either political party. I'm just an American who kind of doesn't even really pay attention. I've maybe voted once or twice in my life. And I'm saying that's just a big conspiracy theory. Don't really watch the news, but you're seeing everything on Facebook, Instagram, Twitter. And that's where you're getting your news from. What would you say to me about that? Like, how can you convince me of that's kind of what's happening? Because all of us can realize that's happening, but like kind of other people don't really see that. They kind of start to say, oh, well, that sounds like kind of a big conspiracy theory.
That's a great question. I think the numbers and the way that this has been produced, and I mean produced as though it's a movie script, because it really fits into something very strange. We can look at the numbers and we can look at some of the indicators. So let's look at the numbers from CDC alone, okay? Let's look at the global numbers as of yesterday afternoon, global numbers reported by the CDC, Center for Disease Control, here in the United States. Globally, there are 125,048 confirmed cases as of yesterday, that with 6,729 new cases included in that number. That's globally, the whole world, 7 billion of us, and there are only 125,000, less than 250,000 people around the globe facing this issue. Out of all of them, 4,613 deaths around the world, including all the global population of the world, all 200 countries that are facing this thing.
This is billions of people.
Billions of people, facing 7 billion people in the planet. Now, look, it will get worse, okay? It will spread. It's a virus. That's what viruses do. But taking that into consideration, this right now, standing as it is, has been operating in China since October, maybe September. It became known to us in December, January. We cut off all travel from China. So let's keep moving with our numbers. Only 26 new cases yesterday were found in China. Only 26 new cases in China. That means it's leveling off. It's dying already in China. It's leveling off in South Korea. It's leveled off in Japan. It's leveling off around the world in these countries that have had it for several months. And as we get better at fighting it, 11 new deaths in China yesterday. 11 new deaths. That means it's leveling off. Let's go beyond that, outside of China. 44,067 confirmed cases as of yesterday, according to the CDC. That includes 6,703 new cases, not added to the 6,729. That's literally outside of China we're talking.
Right.
310 new deaths yesterday, 310 out of 7 billion people. 117 countries, territories with 4 new ones being found inclusive. That's 117 as of yesterday. Now, that doesn't mean that it's not going to get worse and it won't spread. It means that we're not looking at something that's even close to influenza or close to the swine flu. Nothing can.
Or if I could just inject real quick. Or I mean, I listen to a lot of sports radio.
Yeah.
Sorry, the dogs are barking. I listen to a lot of sports radio, and in sports radio, they're saying basically this has not happened in sports where they've shut down basically all major sporting activities since 1918, the Spanish flu. Yeah. So, right. The first thing that comes to mind for me is, and we were talking about it earlier, is it seems like under Donald Trump, everything kind of gets blown out of proportion no matter what it is, and like I said earlier, half the country thinks that he's Hitler. So their
Let's keep
worries and their fears, if they really think that, if they, which they probably do, sadly, their worries and their fears will spread to others, and it's just it's a lot bigger than what it might actually be. So
There's
I
a
can
phrase
speak
for it. Do you know what it
from the
is?
numbers you gave there. I mean, it sounds like for now, we won't know until probably a couple months from now, because, you need a longer of kind of like anything, like a longer test phase where, you see longer graphs and you have more numbers involved.
Yeah.
But
And it
yeah,
won't peak in
definitely.
the United States for another couple months.